Millions of people deal with hair loss in their lifetime, and it's actually very common. Hair loss can occur gradually or appear suddenly, and depending on the cause, it can be temporary or permanent. It is my hope that this video can help you pinpoint which type of hair loss you may be experiencing and why. The first type of hair loss I'd like to talk about is called Telogen Effluvium, and it's a type of hair loss in which the hair remains in the shedding phase of its growth cycle. This causes more hair to fall out than the normal 50 to 100 hairs per day. This type of hair loss is usually temporary and resolves over time. Causes of this type of hair loss are severe stress. Physical or emotional trauma can disrupt your natural cycle of hair growth and can be caused by any shock to your system and can sometimes show up months and months after the traumatic or stressful event. The good news is that once the stress is managed, hair shed should stop and hair will regrow within several months. Childbirth and pregnancy. Some women may experience excessive hair loss shortly after giving birth. This is due to a decrease in estrogen levels. This type of hair loss is a temporary condition and usually resolves within a year. Nutritional deficiencies. The most common is low protein, low iron, and certain other vitamins. Thyroid problems. If your hair loss is presenting with other symptoms associated with hyper or hypothyroidism, it would be a good idea to talk to your doctor about getting your thyroid levels checked to confirm that you are experiencing this type of hair loss. Medications. Certain medications have side effects that can cause hair to fall out, such as blood thinners, Accutane, antidepressants, beta blockers, and cholesterol medication. Birth control. Because birth control affects your hormones, women can experience hair loss when starting or stopping birth control. The next type of hair loss I'd like to talk about is called androgenetic alopecia, and it's essentially male or female pattern baldness. This is the most common form of hair loss as it affects most of us in our lifetime. Males tend to lose their hair from the temples to the crown, and females usually lose their hair in the middle at their part and all over their head. This type of hair loss can happen at any age, but it is more likely to occur in men as they get older and women after menopause. While it's not certain the exact causes of this type of hair loss, we do know that it is related to age, genetics, hormones, DHT, and blood flow. If you think you're experiencing this type of hair loss, there are things that you can try to slow or stop further hair loss. Anagen Effluvium is a type of hair loss in which hair falls out rapidly during the growth phase. This type of hair loss occurs not only on the head, but other parts of the body as well, including eyebrows and eyelashes. Causes include chemotherapy, radiation, fungal infections, autoimmune disease, which leads me to Alopecia Areata. Alopecia areata is an autoimmune condition that causes hair to fall out suddenly. This is caused by your body's immune system attacking hair follicles. Traction alopecia is a hair loss due to pulling. Tight hairstyles, braids, ponytails, cornrows, and hair extensions can all cause this type of hair loss. If you have an itchy scalp associated with your hair loss, absolutely go see your dermatologist. Possible causes of itchy scalp associated with hair loss include allergies. If you don't have any flakes and you have a red inflamed scalp, it's possible that you have an allergic reaction. DHT. As mentioned earlier, this is a white waxy substance that can build up on your scalp and cause itchiness with hair loss. Psoriasis. Half of the people with psoriasis have scalp psoriasis. It may occur in patches or cover the entire scalp. Eczema causes a rash breakout which leads to itchiness. It's important to mention that multiple types of hair loss can be seen at the same time. Hair loss can be tricky, but I hope this information has been helpful and hopefully pointed you in the right direction. Thank you so much for watching, and as always, don't forget to like and subscribe.